Welcome back, everyone, to the Transcending Neurodiversity podcast. Today, we are joined by
Christiana Hargrave. I am a licensed marriage and family therapist.
Awesome. How long have you been doing that?
I have been doing this for about maybe 12 years, give or take. A lot of experience with, being a trainee, then associate, and then becoming licensed and practicing independently.
Amazing. And what is your relationship to neurodiversity?
So my relationship to neurodiversity, as a child, I was diagnosed with ADHD inattentive type. And then much later on in life, when I was in my early 30s, I was kind of informally diagnosed with autism spectrum disorder.
And so, what has your neurodiversity journey been so far? You're now a therapist. Take us through, yeah, take us through the journey. When were you diagnosed and all of that good stuff?
I was diagnosed a few years back, and definitely I think upon first hearing about it, it at first was really difficult to process. But with support, I was able to have a much better understanding, of myself and a better, learned quite a lot about neurodiversity and, expanded my view of what autism spectrum actually looks like for people.
And so you made it all the way to becoming an LMFT. What was it like, rising up the ranks of academia and, doing so much work to get here? Tell us a little bit about that process and specifically, being neurodiverse and going through all of that.
Well, in general, the process to becoming a licensed marriage and family therapist in the state of California does have quite a few steps. I attended Holy Names University on a dual counseling and forensic uh, degree. And when someone is pursuing that, they have to first start off as a trainee. So when you're a trainee, you do begin seeing patients, but you are under supervision. Then once you've graduated and received that degree, that then becomes an internship or what has now been changed to an associateship. Pretty much the same thing where you are working under the supervision of a licensed therapist. And then one has to take a number of exams, and then once you pass those exams, you are then officially licensed. And once a therapist is licensed, they are able to practice independently without needing supervision.
Yeah. And so what were did you face any hardships on your journey, being neurodiverse in kind of a neurotypical system?
Uh, I think that definitely ADHD, while it may seem like it can be difficult, and it is definitely for a lot of people, I, at least for from my own experience, found the structure of college to be very helpful. And, the particular college that I went to had a very clear description of the steps that people needed to take to get the various degrees that they wanted. So they were very clear. They had wonderful academic support, and the heads of the program were super helpful. You could meet with them. And so there was a lot of structural support that I think made it really, really beneficial for me. And I think for a lot of other individuals, neurotypical or neurodiverse.
I guess sounds like you had an amazing, structure around you that just really worked for you. Um, what did you do just for your own mental health, being, maybe inside of academia and also outside? You being kind of a mental health professional, what did you do on your journey to kind of, clear your mind and stay self-regulated?
Yeah. Definitely, I think it is super important for individuals to rely on their strengths, and special interests, I think, were massively helpful in self-regulation. And I actually still do it to this day. I participate in cat rescue. So animals, I think, are very good for regulation for anyone. Animals are very good at tapping into our nervous system. And that was something that was incredibly helpful. In addition to that, I think pursuing education in and of itself was kind of a self-soothing strategy. I had a lot of wonderful classmates and professors that I spent a lot of time with. And, the experience of providing therapy allowed me to learn a lot about people and to connect with a lot of people. It also gave me a lot of experience for seeing, the experience of others in the various positions that they were in.
And I guess what made you want to become a therapist?
Well, that's kind of an interesting one. I think as a kid, we tend to experience hyperfixations, and for a period of time, I was very much into researching, criminal profiling. And read a lot about it and learned a lot about it, and I was kind of like, oh, I might want to pursue that one day. And as I got older, I learned more about it, and like, yeah, psychology definitely feels like something that could really speak to me. So I did kind of start pursuing that, and when I was attending community college, I had a wonderful professor who actually worked in the area that I started out in, which was domestic violence work. And that definitely kind of changed that path for me. And hey, I think that it would be more enriching and, more helpful for society to, serve, to treat others who have been through really difficult experiences. Not to, of course, take away from the importance of law enforcement and, the study of human behavior. And definitely, some of those resources that I had when I was much younger actually proved to be helpful when I started working on my degree, because half of it was, forensic, and we did study a lot of case law assessments that were applied and stuff like that. So that became very beneficial. And as I pursued that path, I felt more and more that counseling was something that felt right for me. And that is what I pursued, and I am still doing it to this day.
And now you're a neurodiversity therapist, or at least you help a lot of neurodiverse clients. What, I guess, did you feel compelled to, I guess, give back to the neurodiverse community, or, do you feel like you have some sort of, sympathy, or, you understand neurodiverse people more? And, do you feel compelled in that way?
Absolutely. I mean, I definitely was familiar with neurodiversity prior to understanding my own autism. And I actually found out I was autistic after I got licensed. So I had been seeing patients for quite a period of time. And it definitely did massively expand what I thought autism spectrum looked like. Autism spectrum was studied on a super, super narrow margin for quite a period of time. Devon Price actually talks about that in his book, Unmasking Autism, so I highly recommend that. And it was only studied on a super, super small population. So I think that is what a lot, not all, but a lot of professionals maybe expect. And what is often seen in media is that small area, when in fact it is a very wide and versatile, spectrum. And so once I was able to better, kind of connect with my own diagnosis, that I think was a very helpful, not only for my self-growth, but connecting with patients, being able to understand that wide, diversity of experience for people, and being better able to support individuals who are experiencing, whatever symptoms they were experiencing, and also help them, kind of find names for what they were experiencing, and, supporting them in perhaps searching for any potential assessment if they felt they needed it, or better understanding themselves and maybe any family history for whom it applied.
Amazing. Yeah. And so I guess in comparison to, you might have already answered this, but in comparison to just like a typical talk therapist, what do you think you, I guess, provide to a neurodiverse client? And I guess also on the other side, what do neurodiverse clients not get from talk therapy?
Now that's a tough question. Every person is unique, and definitely every neurodivergent person is unique. So I think ultimately what is most important is the relationship with one's provider. So your psychiatrist, therapist, fill in the blank, having a good relationship with them, feeling safe with them is utmost, the most important. And, I think with my own experience and understanding myself, it has given me a much, much, much improved ability to be able to validate individuals, to normalize what they are experiencing, And when people feel that, oh, someone is normalizing that, or like, oh, what I'm experiencing is not unheard of, or it is not different, or is not maybe even strange, they can be more comfortable with themselves. And definitely that is important for, I think, a lot of practitioners to be able to do, is to, validate people and validate their experiences.
And so, in who you are, in your journey, in your professional life, do you feel you have any sort of neurodivergent strengths or gifts that you're able to play on in your occupation?
Uh, I think so, definitely. For me, I think a very strong capacity for empathy, something that, of course, any person is capable of, everyone can have empathy. But I think definitely for individuals with ADHD, and again, can't speak for everyone, but for myself, it does open up the capacity to pick up on the emotions of others. And even if maybe we can't, experience exactly what they're experiencing, we're able to recognize, oh, something is going on. I like to say, like, oh, there's a disturbance in the force. So being able to check in with people and how are they feeling? Are they maybe overwhelmed by stimuli? Something that, is definitely really important to understand. In fact, I believe the psychiatrist Daniel Siegel coined the term window of tolerance regarding the stimuli that people can handle or what they can't handle. And definitely, I think being on the spectrum does allow for a lot of creativity and adaptability. So I've been able to incorporate many styles of therapy. I have generally a main style that I use, but I like to add on other types that I have found to be helpful both for myself and patients. And definitely, I think problem solving is really, really helpful. And again, everyone is capable of problem solving, but specifically from my experience being on the spectrum, being able to look at scenarios, implement solutions, and, kind of work where someone is at.
Yeah. Yeah. And so I was going to ask, as a therapist, do you see, any patterns or differences with neurodiverse clients as compared to neurotypical clients?
Speak, for the populations that I have worked with, and definitely everyone may present, in different ways, so it's not a one size fits all. I have definitely noticed that, obviously I think anxiety tends to be a large component of what people experience. And when sometimes it relates to, sensory areas, that usually may be an area that stands out to me. And of course, everyone's, window of tolerance is different. I've noticed that there can be a lot of experiences with thought management. When our body is having a really difficult time processing our nervous system and our mind is just trying to keep up. That tends to be very, very difficult. And, sometimes, again, not everyone, but I think there might be a higher likelihood that, individuals on the spectrum might also be trans. I don't exactly have the numbers in front of me, but sometimes that may be a possibility to consider when people are coming in and, better understanding their identity, or very often they maybe have a very firm grasp of their identity.
Nice. Yeah, and I guess that makes me wonder, and you don't need to have a great answer for this, but do you have any personal theories or hunches about neurodiversity that maybe science hasn't unveiled yet, but in your experience, have kind of just, yeah, had these maybe intuitions about or gut feelings about?
Mhm. Yeah. Well, I mean, definitely I am by no means a neurologist. Definitely, I think neurodiversity does have to do with the structure of the brain. And so I'd imagine there may be some genetic components to it. I have felt that neurodiversity is more of like an expansion of what the brain is capable of what people are capable of. And there are many advantages to it. I have felt that the neurodivergent brain may be able to hold space for many things that, again, not impossible that neurotypical individuals can't experience that. Everyone, is an individual. But I've sometimes kind of hypothesized, our neurodivergent brains may be capable of holding a lot more than we might anticipate.
Yeah. And so when you say holding space
Mm.
for, different things, could you give me an
Mm.
example of that?
Mm. Well, I'd say that definitely art is a huge one. So the capacity for expression, for creativity, for picking up on details and being able to express oneself in a massive amount of ways. The art umbrella is massively huge. And I think definitely, neurodiverse individuals maybe have more openness to perhaps holding opinions that maybe don't necessarily have to conflict with one another. I personally feel that's why DBT, dialectical behavioral therapy, has been very attractive for me, and I found it to fit really well for a lot of things, is being able to hold things that might seem as if they're opposites. Two things can be true at the same time. We can validate someone even if we don't agree with them, but we can see from their perspective. And I think that is something that maybe is not as common in society. Maybe a lot of things tend to be kind of A or B in black and white. And so, being able to hold many things, we can hold space for a lot of individuals and their experiences.
I guess what connection do you see between neurodiversity and just overall mental health and well-being? I know statistically neurodiverse people are more likely to have more negative mental health. There's many different variables you can follow in that. Do you have anything to add or, anything from your perspective about just neurodiversity and just overall general well-being?
Yeah, absolutely. And actually, Sunny Jane Wise is an educator who has more resources on this area. The concept of neuronormativity, where society or societies, whether they intend to or not, tend to be kind of built around the majority in this case being neurotypical, individuals. And so when society is maybe structured around, one area, individuals who are neurodivergent may feel that like, oh, something is wrong, quote unquote, or like I'm not doing things in this way, therefore there's something wrong with that. And we may see that a lot. Let's say, for example, maybe schools who have an idea of like, okay, well then if someone isn't doing something in exactly this way, then is it possibly a learning disability? And maybe in sometimes learning disabilities do exist. But there can be, scenarios where just because someone is not doing something in a neurotypical way does not mean they aren't good at something. So when people maybe feel that they're not fitting into that schema or set of schemas or paradigm, that can definitely have an impact on their mental health. I think, and in fact, another really good book by Devon, Laziness does not exist. People maybe whose systems are very overwhelmed and not able to do the same things in the same way as a neurotypical individual. And so laziness, I think, is a word that is thrown around very, very often, perhaps a bit too often, very liberally. And that can, create a sense of shame for a lot of individuals, thinking, oh, I'm lazy, there's something wrong with me, or I'm not doing what I should be doing, when it is simply their nervous system and their body telling them that, hey, this might be too much, or something maybe works, better in another way.
It's very interesting. And I guess, could you pinpoint a bit, what aspects of the neurotypical world do you see, maybe in settings or circumstances, situations that I think create the most friction with neurodiverse adults?
Yeah. Well, that is definitely, a complex situation. I think there are so many factors that can contribute to so many different things within individuals. So, sometimes maybe individuals who are trying to discover where they want to move into as a career. Sometimes we maybe don't always know exactly what we want to do. And so, is there pressure perhaps to be like, oh, you need to find something within a given period of time? Maybe not everyone is capable, of doing that. Maybe they need to explore other options. Is someone capable of maybe doing the same amount of work in the same way as others are? And if they aren't able to, is that maybe seen, as a negative thing? How do individuals interact with one another? And if someone maybe doesn't act in a certain way, do people view them as weird or different or something like that. So there are a lot of, I think, psychosocial aspects that can apply to people and what may, kind of make them be treated differently by society.
Hmm. Do you feel that neurodiversity and autism, ADHD, these diagnoses, because sometimes people say they're very broad, they can be kind of complicated to understand. Different diagnoses mean different things. Do you agree?
Diagnoses are one of those things that have their pros and cons. And definitely, like I think labeling may be a good example of a con, where if someone has a label placed upon them, how does society view that label? How are they treated as a result of that label? Definitely, there can be a lot of downsides. However, the pros can be, does a diagnosis maybe give someone the ability to have a name for what they are experiencing? So maybe someone has experienced a variety of, let's say, symptoms, or maybe they're feeling like, hey, there's something happening, but I don't maybe have a name for it. And then maybe when they have a name for that, it allows things to click into place and be like, oh, wow, now I get it. I can definitely say that was an experience for me where there were a lot of things, kind of, I was reflecting on, hey, what is there something quote unquote wrong? And then when, autism was brought into the picture, a lot of those dots kind of started to line up. So definitely there can be pros and cons with diagnoses. And I think it depends on a person's experience and where does the diagnosis come into play that, can be considered for, the positives and negatives of that.
Yeah. Would you be in favor of more diagnoses coming out that are maybe a bit more specific to, yeah, the neurobiological variation?
Uh, well, that is also a complicated question. I believe that, autism spectrum in prior issues of the DSM did have a bit more different names, Asperger's syndrome being one of them. And then later on, those were removed simply to have autism, spectrum as a whole. So I can definitely see pros and cons, for having more names for things. I think pros would be if people are able to find maybe more specific names for what they're experiencing. These are definitely positives. But also, can there be limitations to any label? Do people feel that maybe a label fits for them or maybe it doesn't? Does it result in them being treated a certain way? So I can't give like a full yes or no to that question because it is definitely a very, very broad one, but I think one that definitely needs a lot of experts in the room and a lot of discussion surrounding it.
Yeah. Well, you gave a great answer. Yeah, and now I'm curious, what do you think the neurotypical world could do better? Or I guess in other words, how could neurodiverse people be more accommodated? There's a lot of ways we can go with
Sure.
this, but do you have anything in particular that stands out that you think
Yeah.
maybe neurotypicals or just, the way things are structured? Do you have anything that you think really would be a practical, doable shift in the way
Mhm.
things are done?
Definitely. I'd imagine there are probably a lot of things, but I think the number one things that come to my mind is definitely communication. And specifically assertive communication. I like to call assertive communication gentle firmness, where we can be straightforward, but we can be kind. We can communicate what we're feeling. I feel fill in the blank because fill in the blank. I need help with this, or I'm experiencing this in this situation, which maybe sounds like, okay, well, that's obvious. But I think maybe when we take a step back and look at things as a whole, what are maybe things that people expect others to know automatically? Are there many situations where people expect one another to read each other's minds, even if they may not actually think that? Are they saying, oh, well, this person should have known because of the look I had on my face or XYZ, and therefore I'm mad because they weren't able to pick up on that? And another reason why I think DBT resonates so strongly for me is because it does cover assertive communication. And assertive communication, not only is that beneficial for the individual, for them being able to express themselves, but it also makes it very clear for others. So I think, neurotypical and neurodiverse, by being able to communicate what we're experiencing, what we want, what we need. Not only does that make it clearer to any neurodiverse individuals who maybe have challenges with the communication, but I think it can benefit pretty much anyone. And that, again, is not going to radically change the world, but perhaps that will allow, for people to be more comfortable being, direct with one another. And maybe sometimes people can worry, oh, well, if I'm direct, is that mean or rude? And that's not the case at all. When we can communicate kindly, with compassion and with whatever the situation warrants. So if someone's asking politely, hey, could I get some help with this? That doesn't necessarily have to be something that is considered rude, but sometimes, I've definitely heard anecdotally and what others have shared that, oh, well, that's mean or rude if I do that. And so that then creates a lot of confusion about, well, then how can we get our needs met? And again, no form of communication is absolutely perfect. We can't guarantee that we'll get the results that we want. But, being able to deliver the message is just as important as the potential results we may get. And I think there can be a lot of benefits to that. So I definitely would say assertiveness is probably my number one in terms of what people can do.
Yeah, I think that's a great answer. And I think communication facilitates understanding and just being on the same page about things. And perhaps, there is kind of a block between the neurodiverse and, neurotypical world, just having simple conversations and the neurodiverse community being received. So yeah,
Mhm.
maybe it is something about the neurotypicals understanding the communication style more, and I think a lot of growth could come out of that. Have you noticed, I guess, throughout your life or just in all your readings, do you notice progress in terms of, the life of a neurodiverse person and how they're treated by the neurotypical world? I guess, have you seen progress and are you an optimist for the future?
Yeah. Well, definitely, I would say that there has been progress. Definitely, there's still much progress to be had, but there has been, I think, in the field of medicine and mental health, things are starting to open up. More individuals are being studied. And so there is progress of being able to understand the diversity of neurodiversity. And so there definitely has been progress. At the same time, I think there can be things that may be a little difficult, kind of let's say the stereotypes and caricatures of what autism spectrum may look like can, maybe are not coming from a bad place, but sometimes, they need to be taken with a massive handful of salt. Devon Price also covers that in his book that I mentioned before, Unmasking Autism. He has some really good examples of that. So there is both growth, but I think there is always room for more growth, both individually, institutionally, and definitely on a larger scale in society.
hmm So you mentioned this book, Unmasking Autism by Devon Price. And I know we've talked about this book before, that you highly recommend it. Could you maybe explain a bit of what this book talks about and why you recommend it so much?
Oh, yeah, of course. Well, definitely, Devon Price shares his experiences being on the spectrum and not being diagnosed until a little bit later than we might expect. I love his writing style. I think anyone, whether they have a background in mental health or not, can pick it up and understand it very well. He is very relatable, he's very compassionate, and he's very intelligent, and the way he communicates is really, really effective. And reading that book, he covers, I think, probably definitely better than I can, the wide array of human experiences and how neurodiverse individuals may present. And he really does a good job at describing that. So I think that's why the book is so good. Not only is it informative and very educational, but it is really, really relatable.
Do you think uh, that book, I guess, helps neurodiverse people learn how to unmask and like kind of understand their authentic self versus the self that they've had to present to the
Mhm.
neurotypical world?
Absolutely. And hence the title of his book. It does allow for that, showing the different experiences that people may have. They can, better connect with themselves. And I think that is another super important thing that I definitely encourage when I'm working with patients is being authentic to the self. that does a world of good for our nervous system alone. And expressing ourselves, sharing our own interests, and even showing whether it's on our bodies, what we wear, how we style, what we put on our cars, on our devices, can be so healing and so affirming. You know, affirmation is also, I think, massively important. And it applies, I think, as an example in the world of, you know, gender dysphoria and individuals who are learning about themselves. That affirmation does so much good for their mental health and their nervous system. And I think the same applies to neurodiverse individuals. And I think as a whole to human beings in general, when we are able to be authentic to ourselves, it is very enriching and rewarding.
Hmm. Yeah, so if I'm understanding this correctly, it seems like just having the capacity and the space to just be unapologetically yourself and just express yourself in whatever way, maybe artistic, that is something that I think a lot of neurodiverse people can really benefit from, not just, for pleasure's sake, but also really it's healing, and it really, I guess, changes the psychological sphere inside their head. Is that correct?
The exact neurobiology I don't have in front of me, but it can definitely be very, very helpful. You know, there may be a lot of experiences, let's say, as an example, social anxiety. And whether that presents in someone who's neurodiverse or neurotypical, it often focuses on, oh, how do others perceive me? How do others see me? And so people might, you know, experience like, oh, how do I act? What is the right way to do fill in the blank? And I often encourage people that, like, hey, it's okay to be true to yourself. And at the same time, you know, being dialectic, we do have to take into account social situations, but I think that is something that applies to any person. You know, we have to be aware of what setting we're in. At the same time, you know, two things can exist in the same place. We can still be authentic to ourselves and, you know, adjust to what the social situation may require. That may just look different for different individuals, but both of those things can coexist with one another.
Hmm. And obviously, in the mental health conversation these days, it's hard not to mention the effects of technology, digital media, social media. Do you have any particular perspectives on how those things have maybe, yeah, just impacted neurodiverse people, both maybe positives and negatives? What's the first thing that comes to mind with
Mhm.
this topic?
Well, social media, I think, in and of itself is a complex thing. There definitely have been positive effects. People who maybe feel that they're alone in their experiences have been able to find out on other platforms, let's say TikTok, Instagram, Twitter, that, oh, there are other people who have those experiences. So definitely a plus there. At the same time, social media has its downsides of harassment, misunderstanding, you know, spreading of misinformation. So it is a delicate balance on what people feel is best for them. Using our devices, you know, is definitely helpful, but I think that we can have too much of a good thing. And so we want to be able to both interact with the world around us and self-care. And at the same time, we can do things that we maybe find soothing. But we want to have, I think, a very large toolbox with a lot of tools in it. And a digital device definitely can be maybe a small tool in certain instances, but we want to be able to have a lot more things that we can rely on to care for ourselves.
Amazing. And yeah, you caught my attention with misinformation. So in the conversations or communities online regarding neurodiversity, autism, ADHD, is there any, yeah, misinformation or false notions that you've noticed? Especially, I consider you more of an expert, more knowledgeable on this topic. When you go online, what are some pieces of misinformation or just misperceptions that you see being spread around the web?
Mhm. Yeah. Well, I definitely think that what autism is expected to look like can still be in those narrow margins, and that's just as capable of spreading online as it is in other realms. So people may expect, like, oh, someone who is on the spectrum never makes eye contact, only moves in very rigid ways, is very, very rigid and massively structured. And that's not always the case for everyone. I would definitely say that, in our modern political climate, there was unfortunately some really unhealthy behaviors that was portrayed by a certain individual, and people were trying to say, oh, that's because of autism spectrum, when in fact, that is not the case at all. And unfortunately, there were some really, really offensive examples of parents using their own autistic children and making them perform a hateful gesture as a way to, oh, it's because of this, let's excuse this. So that, I think, does a massive, massive deal of harm to individuals on the spectrum. And at the same time, there are, positive experiences where people of all shapes and sizes are able to share their own experiences, and they, may look very different from one another. They may present very different from one another. So definitely there has been a lot of negativity, but there is also some positivity as well.
Hmm. Yeah, totally agree. I think in the neurodiverse community, we've all been witness to that. And so
Mhm.
yeah, recently it's been a little more crazy. So if there are neurotypicals watching this video, are there any ways they can support their neurodiverse loved ones? Or I guess what are some ways that they can support their neurodiverse loved ones that maybe they
Sure.
might not be aware of?
Yeah. Definitely, I think it is important to, first of all, expand on one's knowledge of what neurodiversity looks like. So definitely educate oneself, look into experts, talk to experts, do a lot of research, and also being able to communicate with that person, being able to ask them what do they need, what are their experiences, and also, communicate back and forth, being able to share with one another and learn about one another's experiences. So definitely we do need to be able to talk to one another and support one another. And, when people maybe find themselves having a hard time believing someone is neurodiverse, I would definitely encourage them to maybe challenge that belief that they have within themselves. If someone is coming to them saying, hey, I am fill in the blank, I'm autistic or something, and they feel that, oh no, this person is not, we don't want to dismiss someone. I think dismissing someone can be really, really harmful to them. Being able to affirm them and talk to them about, hey, what are you experiencing?
Hmm.
What are you experiencing? Talk to me about it. And, we may find that very often people can be very accurate in their assessments of themselves and what they are experiencing. And when we dismiss people, that definitely can cause a lot of harm, especially in the professional realm, where again, the autism spectrum was studied on a super, super narrow margin. And so when an expert is saying, oh no, this person can't have fill in the blank. I have had that experience with patients where I have encouraged them to, let's say, seek out assessments, given them resources, encourage them to talk to their psychiatric provider, a psychologist. And in a lot of instances, they received a massive amount of support. But there have been examples of individuals who did, advocate for themselves, and they were dismissed. They were told, oh, no, you don't meet the criteria. This is not, no, that I don't think it's applicable. And it is important, especially for professionals, to be able to affirm someone and listen to their experiences. And assessments can be done and, tests can be taken, but ultimately that validation and affirmation is incredibly important.
Yeah. And now on the contrary, because I know now with autism and ADHD diagnoses going way up in the last few years, and there is kind of this talk about, it's cool to get a diagnosis of autism or ADHD. Um, do you believe there might be maybe an over diagnosing going on more in like an informal sense, and a formal sense, like I guess not formal, but official diagnosis. So official and unofficial diagnoses. Um, yeah, do you feel like that's something that you notice being the case? And yeah, tell me more.
I think is also another complexity because sure, are there individuals who maybe are misdiagnosing themselves because of wanting to fit in? It's theoretically possible. I would personally, am of the belief that that is probably not the case. Naturally, people do want to feel a sense of belonging and connect with one another. But I think that is also an argument that has been utilized by anti-trans groups of like, oh, it's cool, it's the in thing, when that is not the case at all. Being trans is not by any means historically new, and neither is being on the spectrum or being neurodiverse. So overall, I would probably say that's not the case. When people are learning about themselves and better understanding themselves, and then maybe now that we have more information about both these areas, you know, being trans, being neurodiverse, etc., it is not that there is a magical higher number. It is that more individuals have a name for what they are experiencing and they feel safe to communicate. The same thing could be said of maybe way back in the day when being left-handed was criminal. And you couldn't say that you were left-handed because you would probably be executed or mistreated in some shape or form. And that's something that I think has existed for quite some time. But then when that attitude was changed, when people no longer had to fear for their lives for being left-handed, we can notice statistically that, oh, wow, there's a lot more left-handed people. They didn't just magically appear out of thin air. They felt safe to be true to themselves and be who they were. And I think the same thing applies in these instances where it's very unlikely that just the number magically rising is not what is happening. It's people have names for their experiences and for what, you know, for how they identify themselves. And so then they feel safer to share that with society, with their loved ones, with institutions. And I think that is definitely what is happening in societies where people feel safe.
Hmm. And so what do you think is the importance of role models in this case? So neurodiverse role models, I know we mentioned the bad role model or just the bad
Mhm.
example, but yeah, what are some of, I guess maybe in your personal experience or what you just feel in general, are good neurodivergent role models that maybe have helped
Mhm.
you along the way, or you've seen have inspired others in a good way?
Yeah. Well, definitely, I think it does depend on where the role model exists, but there is capacity for anyone in the public eye of any shape or size to have a positive benefit. I can definitely say that clinicians such as Devon Price and Dr. Nick Walker are very, very large role models in my field. Let's say maybe in the more let's say in the media realm, there are individuals who are on the spectrum. If I recall, I believe Daryl Hannah has shared her experiences, Anthony Hopkins, and I believe the actor Paddy Considine has also shared his experiences about being on the spectrum. And these are individuals that we might never have thought that, oh, that's what they're experiencing, but they are. And they are incredibly talented and have reached a very wide audience. And so I hope that, individuals like them can allow people to recognize that, oh, being neurodiverse does not have to hold anyone back from being really good at what they do.
So someone is watching this, they're neurodiverse, and they're wanting to improve their mental health, and they just want to be steered in the right direction. What is something or some things that you recommend as just the first things you should really, that you would really recommend for the mental well-being of neurodiverse people?
Sure. Well, I have my own therapeutic styles that I feel to be very helpful. Doesn't mean it will work for everyone, but just to put that out there. I have found DBT to be tremendously helpful. Not only do I enjoy practicing that with any patients, neurodiverse or neurotypical, but it does cover a lot of territory that I think can be really, really beneficial. It covers dialectics, emotional regulation, distress tolerance, interpersonal effectiveness, and mindfulness. And these areas I find to be really, really beneficial. But again, not everyone maybe works the same way. And so maybe a lot of people may find this beneficial for them, maybe not everyone. IFS, internal family systems, is also another therapeutic style that I have only recently begun to explore, but I found that to be really helpful. And in terms of, let's say, outside the world of therapy, I would definitely encourage individuals to be authentic to themselves to definitely listen to themselves, to connect with their bodies and pay attention to what is my body telling me, what are my experiences, what's happening for me. And then externally being able to find healthy communities, to being able to find support. So people who have similar experiences, neurodiverse individuals, but also people who can be allies, who can affirm them, who hear them, and are willing to support them.
Is there anything that we
So
haven't covered in this podcast that you think would be just beneficial, you just like to put out there?
definitely think that the subject of neuronormativity is one that I would want society, and especially I think a lot of mental health professionals, to have a really good understanding of. And, like I said, neuronormativity can be a form of centrism, be that like androcentrism, ethnocentrism, heterocentrism, where a lot of things are viewed in a specific lens. And when we're able to take a step back and view things from a very, very broad lens, from taking in the experiences of many different people, as many groups of people as we can get a more accurate understanding of any field, and definitely in mental health. When we're able to hear about everyone's experiences, we can have a better understanding of what something may look like for everyone. And as a societal whole, it's important for society to understand that neurodiversity is not just that one singular box. It is a wide spectrum. I personally tend to view a ton of things as being on a spectrum, be that neurodiversity or anyone's skills, problem solving. I view a lot of things as spectrums because it allows for so many shades of gray, so many experiences. Things don't have to be black or white, either this or this. Anyone can fall anywhere on a spectrum where they feel, is important for them and how they move throughout the world. So definitely opening up discussions about neuronormativity. And I would encourage all professionals and all mental health professionals to definitely read up on the latest literature, get to know a lot of neurodivergent individuals, and educate themselves in whatever their field may be to have a better understanding so that they can better serve their patients and validate them and be there for them.
Do you think mental health professionals these days, just, generally in the way that they're educated and yeah, just generally speaking, do you feel like they're up to date with all the, beneficial, necessary neurodivergent information? Or do you feel like there's still a lot of space for them being educated and them being trained to help neurodiverse people?
Well, I definitely say both. I can't speak for every mental health professional. And, there are excellent ones out there, and there are others who are still wonderful at what they do, but definitely could benefit from learning more. So I would say both. There are wonderful mental health professionals out there who are incredible at the work that they do. And at the same time, I would encourage every mental health professional to continue to educate themselves and update themselves as often as they can on this area and many other areas regarding mental health, because we are ever growing, evolving, and we are understanding more and more things as we progress.
Absolutely. Now, I guess I just thought of this question on the spot, but is there any legislation, because I know with the Disabilities Act and everything, the disabled community has been positively impacted in the past through legislation. Is there any legislation that you think would be beneficial for the neurodiverse community? And obviously, it's kind of a out of nowhere
Mhm.
question, but yeah, does
Yeah.
anything come to mind?
Well, that is also a tricky one because just like labels and diagnoses, there can be pros and cons. And, I tend to have a very broad view of what may be considered disabled. But again, just because someone maybe has one thing or another does not necessarily by itself prevent them from being really good at what they do. So I would definitely defer to experts on what legally constitutes a disability. What does the state or on the federal level, what do disabilities consist of? That being said, even if, let's say, someone maybe doesn't fit the exact legal definition of what is presently, considered disability, what services do they need? And I am definitely a big proponent of people having access to the services they need. And there can definitely be challenges with that. Sometimes when people need access to certain services, are they able to get them only if they have a diagnosis? That can definitely happen. And so I think it maybe speaks to maybe the American system on a broader sense of what people do and do not have access to. So there are, I think, a lot of different pieces involved in these areas, and I am probably not the voice to best speak to them. But they are, I think, things that do need to be examined, need to be looked at. And when they do, I would hope that whoever is crafting legislation educates themselves and gets as many experts as in the room as they possibly can to make sure that everyone is protected and served and gets what they need.
Hmm. So what I understood from that is that the I think maybe the biggest political factor right now to, I guess, the health of the neurodivergent community would be the healthcare system, and actually just having healthcare be more and more accessible.
Mhm.
Would you say that that's correct?
Absolutely. I think that is something that has been an issue for quite a while, even outside the realm of mental health. And I think especially with assessments and diagnoses. Again, I'm not a psychologist myself, so I can't exactly explain the nitty-gritty, but from what colleagues have told me and what I have observed, that especially, getting an autism diagnosis can be very expensive, and not everyone may have access to those resources. And let alone many other assessments out there that can be really, really helpful. I think these are services along with pretty much all healthcare services that I would hope could be expanded so that anyone can get access to them and get the support they need, get any diagnoses they need, any services that they need.
Do you see and do you have clear examples of neuronormativity manifesting itself in like an institutional sense?
Mhm.
So like in
Yeah.
career, in government, et cetera, et cetera. Because obviously, yeah, there
Mhm.
is the conversation about neurodiversity, but yeah, I guess what are some of these institutional manifestations that you've seen?
Mhm. Well, I definitely say that I have been aware of instances where individuals who are indeed neurodiverse, like I said before, have requested services and their mental health professionals, or some, again, not all, but some of them were dismissed. So like, oh no, you don't meet the criteria for this. You don't have fill in the blank, so I'm not going to provide this service. I can't, speak for all assessments, but there are sometimes scenarios where individuals maybe who have been, whether they intend to or not, have been masking. And when they take an assessment, is the validity of that assessment, in question? Because when they've learned to mask, maybe they're not answering questions that might, give the best answers in terms of whether or not they are neurodiverse. So I think there is a lot of wiggle room. And again, I'm not the authority on assessments, but definitely I think in the professional realm, there is that dismissal. And I think also on a societal level, again, not everyone and not every institution, but when we have that narrow view of what, let's say, for example, autism spectrum looks like, there can be that dismissal. And I can definitely share, like, from my own experience, having to request 504 accommodations. And I was told my grades were too good. So there was definitely that assumption, and that again may not even been that conscious assumption, not necessarily bad mouthing any one party or another, because at that school that I went to, there were individuals who were very affirming and understood the nuances. But in that, for some, there was maybe that thought of like, oh, does a learning disability or what is perceived to be a learning disability, does that equate to one's intelligence when those two things are, separate from one another?
Well, amazing. I think that's it for my questions. Again, is there anything that you're like, I need to say this?
I think, I appreciate you having me on. This has definitely given me the ability to share a lot of things that I have definitely been wanting to express. And so, the books that I mentioned, and hopefully the resources I sent, we can pin those wherever they are accessible. I would definitely encourage people to check those out. And, I am definitely, wanting to communicate to people to be themselves, to be proud of themselves, have confidence in themselves, and express themselves in ways that they feel are true to them, across the board, be they neurodiverse or neurotypical.
Yeah. And, as we've talked about before, all of your resources I'll put in the links or in the bio below. And so I encourage anyone listening to check those out. And yeah, I super appreciate having you on. Thanks for letting me pepper you with all these different questions and insights that came to mind. And I found this a very valuable chat. And I think, whoever gets to listen to this whole podcast, I think will walk away with some amazing advice and direction. So thank you so much for your time, Christiana. And
Thank you very much for
for
having
anyone
me.
watching, like and subscribe to Transcending Neurodiversity. And comment below if you had any insights or anything that came to mind during this podcast. Thank you and have a beautiful rest of your day.